Thank you so much. Thank you so much, Greg. And it was such a great session. Michael, thank you so much for sharing your wisdom. And it's made it very real, you know, all the small things that can make a huge difference, you know, to see what prevention looks like in practice. And also, really, the realities of how, as human beings, there's definitely a tendency to overcomplicate things. So I think what frameworks like Michael's really give us are ways to simplify what otherwise can become even more complex than need be. But we now move to our next session. I'm really pleased to be here with Will Moy, the Chief Executive of the Campbell Collaboration, and before that, he was at Full Fact as well. And Will, you're part of a global movement for what works. And I remember when I first came across your work, I essentially went along to a What Works global conference in London, and I was amazed that there were like hundreds of sessions, and there wasn't a single one on housing. So I'll never forget this. And this is when I went up to your predecessor and said, do you realize that there's absolutely nothing on housing? Why is this? And the other thing that never left me really from that occasion is very much how there seems to be a correlation between how confident we are about our understanding of what works in a particular field and how undeveloped the evidence base actually tends to be. So the less underdeveloped, the more confident people tend to be about their knowledge of what works. So again, we've been on a journey together to do something about this on homelessness. But obviously this morning is about more than just homelessness. It's about prevention further upstream. And I wonder if you can say a little bit about, at global level, what do we know about things that really help keep prevention upstream?
Sure. Actually, you've reminded me of talking about the overconfidence when you don't know enough. Had you had a heart attack in the 1980s, you would have been given anti-arrhythmia drugs to help prevent any recurrence. These were recommended by the textbooks of the time. They were backed up by research in medical journals. And it turns out that they were 28% more likely to kill you than if the doctors did absolutely nothing. And that's in medicine, where it's relatively easy to know what works and what doesn't, where research is more predictable and systems are less complex, at least, than they are in homelessness. So it's, I think, extraordinarily powerful the way that CHI and you are talking about the need to think about prevention really seriously and to build systems that prevent. What we've seen, I think, repeatedly in the wide range of fields that Campbell covers. Campbell basically covers all of public policy, although as Ligia points out, it's very easy to say that and it's hard to live up to it. But Campbell has groups working in fields as diverse as aging, disability, education, crime and justice, right through to sort of business and management, so a very wide range. And in all of these fields, it's much easier to do whiplash responses to acute problems than it is to step back and say what would stop these things happening again. In criminal justice, as many of you will know, it's much easier to get politicians excited about locking people up or having more police officers than it is about genuine approaches to preventing crime. We had another great example of that. Some of you may have heard of a TV program called Scared Straight, or similar kinds of initiatives. You may remember, I think Sir Michael has gone now, but Tony Blair once talked about marching young people to the cash machine when they had indulged in antisocial behavior, as I think he would have put it at the time. One of our esteemed colleagues in the crime and justice field, who was a former police officer, became an advisor at the Home Office, is now a professor of criminology. So he's one of these amazing people who's really seen, you know, got his hands dirty in government in a very different kind of dirt, and also done serious research. Home Secretary goes to him one day and says, I've got a great idea. What we're going to do is we're going to send these young people to boot camps. Military-style boot camps, that'll sort them out. And he calmly gets out a Campbell Collaboration summary of the research, a systematic review, as we call them, of all the research on these scared straight programs, which have been popular for a while. You can see how a politician every few years will grab that idea and say, yes, we should send them to boot camps. It's been tried. There's been bits of research produced saying what a great idea it is. And then it turns out that when you really look at it, it does more harm than good. It makes those young people more likely to reoffend, more likely to continue to be involved in the criminal justice system. And actually, when people put numbers on that, for every $1 spent on those kinds of boot camps, it cost $200 in new problems that intervention created. Astonishingly counterproductive. So the unofficial motto, I think, of the What Works movement should be, it's a new acronym I learned recently, DDSS. Don't do stupid stuff. It's really easy to do stupid stuff. And actually making the case patiently for thoughtful stuff is hard. And it involves building an evidence base that isn't just one study. Look at my piece of research that says that my pet idea is a great idea, because it turns out you can do that and that research can be wrong. But looking at all of the research, filtering out the research that isn't good, isn't well designed, isn't answering the right question, and so on, summarizing that research carefully to pull out the actionable lessons, and then taking that to people like you who can do the real work and making it useful. Campbell is just one tiny link in this chain that would be necessary to create this golden age of homelessness that Sir Michael tells us we can have in the future. But our little bit of that is doing those systematic reviews of the research, helping people get a real overview of what the evidence says and which bits of that evidence are useful. And that's what we've been working with Ligia on ever since she met my predecessor.
Thank you, Will. And what we also seem to know from the international evidence is that sometimes the simplest interventions can be most powerful and improve a range of outcomes. Unconditional cash transfers come to mind. What have we learned across the globe?
Yeah, I suppose, like so many things that are backed up by evidence, sometimes simple ideas turn out to be wrong, like the scared straight examples. But so many of the things that have good evidence behind them are what you might think they might be. So some of the work we did with CHI in the early years, and this is before my time, but was on, for example, accommodation and systematic reviews that you were leading there, Ligia. As I understand it, showed that if you give people accommodation unconditionally and then wrap around the support to help them work, that's the most effective way of doing accommodation-based interventions. That in health and social care, people with many different kinds of care needs need wraparound, personalized, person-centered support. You know, these aren't radical ideas, but with the right evidence base, it's possible to show exactly how much of a difference these make and which different kinds of approaches can work. The problem we find, I think, in homelessness more than most is we don't always have that evidence, and we haven't always been able to prioritize the use of evidence. So one of the things I find really interesting, the world that Campbell comes from started in medicine. In medicine, doctors have this idea called I don't actually know how the word is meant to be said. I think it's iatrogenic illness. It means illnesses created by doctors. They have this idea really powerfully built into their profession. First, do no harm. It goes all the way back to that. Doctors can cause illnesses as well as cure them. And when I talk to teachers, when I talk to police officers, and I don't want to assume, but perhaps also in your community, we don't have quite such a powerful idea that we can do harm as well as good. And if we don't understand what the evidence tells us, then even the things that seem like simple and obvious ideas can turn out to be harmful as well as positive. And that's why I think the contribution we make working together can be really helpful and can be really surprising.
And how can we help people understand why not all evidence is the same, I guess?
Yeah, I think that's a really great question. partly because when you're just trying to get the real work done, anyone who comes along trying to offer something that looks like it ought to be helpful, you want to make the most of that. And actually being able then to critically assess the difference really matters. But it's so easy. And actually, I think it's probably more obvious for those of you who work day to day with people who are experiencing homelessness than it is sometimes for the researchers, that a study done with one group of people in one place won't necessarily be relevant to a different group of people in a different place with different needs. And some research will just say, oh, well, we did this with these people over here, therefore it must be true for everyone. And that's sort of obviously not true, but it's the kind of thing that in the abstract people can start to believe. We took a group of people experiencing homelessness, we did this, therefore everyone should do this. It's the kind of mistake that researchers can make quite easily, sampling errors, essentially. So that's why, for the reason I came into Campbell's world, the systematic review world, from my old job in Full Fact. Full Fact is a fact-checking organization. Our job was to call out politicians, journalists, and others when they said things that weren't true. Losing friends and influencing people, I used to call it. So we would be ringing up number 10 saying the Prime Minister just said this thing, where's the evidence? Oh, actually, it's not true. Can you correct the record? All of that kind of thing. Had a lovely time with some of our Prime Ministers over the 13 years I did that. But the reason I came into the systematic review world is that systematic reviews look at all the research and they ask the question, is it any good or not? And academics don't tend to do that about other academic research. Yes, you have the peer review process, so to get it published, it has to kind of cross a bar of kind of quality if it goes through a proper peer review process. But once it's out there, people kind of tend to say, well, this is research, this is evidence, we should take it seriously. Systematic reviews don't do that. They actually say, no, lots of research isn't that good, and we're going to test it. We're going to work out whether the research design is any good. We're going to work out whether the sample is actually relevant to the question we're going to ask. We're going to work out whether there is a risk of bias in this research. Has the funding biased it? Has the research design biased it? And so on. And in doing that, it filters out an awful lot of the research that seems to be relevant to a question. So when it's usually academics doing systematic reviews, or at least part of a team, when they do systematic reviews, they will often look at thousands of pieces of research that might be relevant to a question, and then discard all but 10, 20, 40, 50 of them. And those are the ones that are designed in a way, for example, that let you look at cause and effect. It's really easy to do a study that says, in essence, oh, look, when people eat ice cream, more people get killed in shark attacks. And of course they do, because on sunny days, more people go in the sea, more people eat ice cream, more people get eaten by sharks. Obviously, better example in Australia. But it's much harder to say, does eating ice cream cause shark attacks? Obviously, in that case, no. But in the case of something like homelessness, you know, the quality of research you have to do to really understand, has this made a difference? Is this the thing? Is this the intervention that actually made a difference, or was there something else going on at the same time that changed the factors? You need to do really smart research, really carefully designed research to do that. And a lot of the research that claims to answer questions like that bluntly doesn't. So I love systematic reviewers because they don't take all research at face value.
And when it comes to then getting, whether it's prime ministers or practitioners, getting them to listen to the evidence, that's a job in itself, right?
Yeah.
Why is that? And what does human psychology tell us about it? And what tools help to turn that rigorous evidence into practice? Yeah,
well, no one likes changing their mind, do they? Once you've put yourself out there and said, yeah, I really believe in this, it's a bit hard to turn up the next day and say, oh, I found some better evidence, I found some better ideas, I'm going to do something else now. There's that famous political line, I can't remember who said it, but when the facts change, I change my mind, what do you do? Well, the answer is you don't change your mind, and neither does anyone else. It's actually really hard to get people to change their minds. So that was kind of what I spent most of my time at Full Fact doing. The ideal answer is actually you get to them before they've made their minds up. And that's why I think long-term programs of building the evidence are so, so important. The research for Ligia kicked off in, I think, 2018, 2019, is now, if you like, the set of prejudices that people start the conversation with, who are just joining in now. There's this lovely line, I think it may have been Einstein: common sense is the collection of prejudices you have acquired by the age of 18. In politics, the collection of ideas you have in your head before you write the manifesto, that's the reality you work with. And if you can get ahead of that, it's much easier to have an evidence-based debate. So at Full Fact, one of the things we used to do was track a survey called Issues Facing Britain Today, which asks people every month, what do you think are the biggest issues facing Britain today? Free response question, you can say whatever you like, and look at the things that were beginning to emerge, beginning to bother people, and then make sure there were good briefings on what the evidence said before they came politically salient. If you can do that, and similar with the example I gave of Scared Straight earlier, you can also do that within government. You've got an advisor who, when the minister says something stupid, can say privately to them, actually, I've got good evidence here, it's summarized in one page, have a quick read of that, and then DDSS. But when people have come out publicly, that's where it's more difficult. And here's a piece of advice that can save your relationship, your job, and many other things. You can't correct somebody just by saying what you said is wrong. It doesn't actually work. What you have to do is give them a new idea instead. So the formula for correcting people is you tell them that what they've said is wrong, you tell them why it's wrong, and you tell them what's true instead. And the psychology of that is if you give people an idea and then say it's wrong, the memory stays in your brain, but it gets tagged with, and it's wrong. If you give them a news story, it gets replaced in your brain by the news story. So if you remember back to one of the most awful bits of work we did at Full Fact, the Troubled Families program, I think it was officially called, which identified a relatively small number of families who had several of 9 different experiences or engagements with public services or whatever, and recognized that there were particular needs there and particular need for extra public services and so on. There was some good thinking, as I understand it, in there. It was described in much of the press as problem families, and in one particularly memorable front page as scum. And we were there trying to work out how do you respond to violent political attacks on people who don't have a voice in public, who deserve to be well supported, who deserve to have services that actually look after them, and who, in an effort to do something helpful, have suddenly been singled out and viciously attacked. And the answer couldn't just be go out and call these things out, although we did, and we got newspaper after newspaper to correct the record, to recognize that they couldn't run those headlines, and in doing that, and enforcing them to correct the record, to stop running similar stories. But what you also had to do, we went back to the original researchers and said, look, you need to update this research and you need to explain much better next time what your research really means. So one of the responsibilities, I think, of doing research in areas that can become highly politically polarized is then explaining it in a way that can't be taken advantage of by people who want to polarize, who want to make things angry. And it's quite easy to be a bit naive and put something out that can be misrepresented. And part of what I think is really important is thinking about how your research can be represented to help people and to communicate that effectively, but also think about how your research can be misrepresented and then communicate it in a way that makes that more difficult. And so the Ministry of I think it was Justice, started doing something on their statistics releases about family justice that I'd never seen before, but I thought was wonderful. In their summaries, they said, with this research, you can say, bullet point, bullet point, bullet point. With this research, you cannot say, bullet point, bullet point, bullet point. And sometimes being clear about what you can't say is just as important as what you can say to stop the politicians running off, sometimes maliciously, sometimes accidentally, with a wrong idea.
Thank you, Will. And evidence-based communications is just so critically important in our area. We know that a lot of the communications we put out there help reinforce stigma. And it's interesting what you just said around fact checking, because big experiments have been conducted that show that if you do confront people, they're not just more likely to believe the lie, but they also tend to assign the lie to you. So it's really dangerous territory, and I do think it's not looked at enough. But one of the things we haven't explored yet is some other habits that I think are worth bringing up. So something we've seen is certainly, for instance, the fact that people have this habit, and again, this is linked with how underdeveloped the infrastructure is, of if they're doing a thing, they want to prove it works. So, they will want to commission something that shows that their model works. So it's not really done in the spirit of, I actually want to find out whether it works or not. It's very much as a way of, oh, my funder needs X and Y. I'm going to portray this in the best possible light. How do you help break habits like that? Also, the other habit I've seen over the years, because many people are going into our maps in the early days and saying, but our work isn't there. Why isn't it there? Well, because it's not an evaluation. So again, another habit that it's really fascinating to see is how many of the claims we've been making about what works in homelessness are actually based on the back of who is affected and what we know about them, as opposed to what we know about the intervention itself, which is often very ill-defined and hard to evaluate as a result. So what do we do about those two habits?
I think it goes back to what I said about doctors earlier, understanding that you can do harm and being actually genuinely concerned about the difference between what the best work you could possibly do is and what you might actually be doing. And Michael Barber said it earlier, it's just unprofessional if we know that there is best practice out there not to be using it. And if you start with that attitude, which I know is easier said than done in practice, but then you have to get really interested in how do we evaluate our work effectively. And of course, no one's a very good judge of their own work. It's one of the things I say to anybody doing public speaking. Never ever come off stage and think, how did I do? Because you don't have a clue. You actually have to get feedback from somebody else. You're always biased in your own evaluation of your own work. And similarly, it's really hard for political reasons, for funding reasons, and for other reasons to do realistic evaluations of your own work. So the first thing I would say is independence matters. That's why an institution like CHI matters, and I think the vision Ligia set out is so critical. We have to build evidence collectively as a community by looking at all the work that's going on and evaluating it together rather than individually as organizations as a way of seeking advantage and seeking funding. And that's an extraordinarily powerful approach, and it is an approach that funders actually really respond to, in my experience. When you say that as a sector, we are collectively committed to doing better, and we need your support to do that, I think funders can really buy into that. But then you need that research to be done genuinely independently by people who know what they're doing, and in a way that can isolate which interventions work by understanding what effects are they causing. That requires skilled people who know how to design that kind of research and make it work in the real world. So it's one thing to do a randomized control trial in a hospital where you've got a bunch of patients experiencing roughly the same intervention, and they're lying in bed and they're asleep, and you can control what a doctor can do with them. It's quite another thing to do a piece of research that can genuinely understand causes and effects in the world of homelessness, or in another world I work in, humanitarian interventions. But it's no less important. We need to think about it harder, about how we do that. It needs to join up that whole delivery chain that Michael Barber was talking about. You can't actually do high quality research by just getting some academics and sticking them in a university and hoping they'll figure it out. They've actually got to join up all the way to ultimately the people who the interventions are meant to benefit, and the people working with them, and the people running the services behind them, and the political decision makers. You've got to cover that whole track in order to be able to build this evidence base. So rather than thinking of it as I think academics are sometimes prone to, as we do the research, you've actually got to have a collective will to generate the knowledge to make it possible to do the work that will change lives. And I couldn't agree more with Ligia that if we're going to have this long-term goal of homelessness being rare and being brief and being one-off, then building the evidence base is, if not the first step, then a crucial step to doing that. It's got to be long-term, and it's got to be something we all collectively work out together.
Thank you, Will. And before we finish, I just need to ask your thoughts about the importance of combining systems thinking with the What Works approach. Why does it matter? Because I often give the example, and I talked about buckets and drips today, that even the most effective interventions like Housing First, they're no more than mopping the water off the floor. Why does it matter to combine, the rigor of assessing what works, but also bearing the wider system in mind?
I mean, I suspect all of you know that vividly and personally in the work you do. If you mop up something like Housing First, but you haven't figured out, it may be the immigration rules, it may be the health and social care provision, it may be integrating criminal justice system, law enforcement, whatever. The reality is that what affects people's lives isn't that simple. And so if we really want to understand what works, we can't imagine that there is a switch somewhere lying around to be found that will end homelessness. Nobody thinks that. Nobody in this room surely thinks that, and you all know far more about it than me. What it is this long chain, this very complicated, intertwined set of chains that all need to be doing the right thing. And we can show decision makers in other sectors, we can show leaders of healthcare, we can show leaders of law enforcement, this is how the thing you think you do impacts on this thing that you don't think so much about. It is possible to show them that, but it's only possible to show them that if you look at the whole system and recognize that what you are focused on doesn't seem like their main day job, and unless you can show it to them as here is the effect you are causing through your choices, you won't be able to make that difference. And in every important field I work in, healthcare is now increasingly focused on what they call the social determinants of health, because they recognize that actually if we want to close the gap in, say, life expectancy between the rich and the poor, it's not just about having good hospitals, it's about a whole bunch of social phenomena that lead to people having healthy lives. In promoting literacy globally, I'm working with lots of UN bodies on delivering evidence for the Sustainable Development Goals. You can't promote literacy if kids aren't getting to school in the first place. It's just an entirely different, and sorry, I say that as if that's not relevant to this country. Of course it's so relevant. So yeah, we live in a world where we want to make a difference to people's lives, and people's lives are complicated. What works isn't about just finding the simple answers, although they often are there. There are simple choices we can make that are better than the choices we are making now, and we need to discover them. But to solve the whole problem, we have to recognize we're part of a complex picture and go back to all of those other players in the game and be able to show them what difference they can make and get them excited about that. And I think that's exactly the path you've laid out. And I really think it's wonderful. I'm so glad to be here and to do anything I can to support you all.
Thank you so much, Will, and it's great to have you as an ally in this struggle. And let's thank Will.